Hi, my name's Cheyenne Thomas. I'm a nursing student, and today I'm going to be doing a neurological assessment. Can I get your name and your date of birth, please?
Mary Smith, 7/29/70.
Perfect. Thank you, Mary. Mary, do you have any allergies that I should know about?
I don't.
Nice. None? No allergies to medication or anything?
Mm-mm.
Good. That's awesome news. So, like I said, today we're going to be doing a neurological assessment. That's going to involve a bunch of things, including looking at your face, having you do a bunch of different facial expressions. I'm going to be using a light to look at your eyes and in your mouth, and then a few just resistance. So I will have to touch a little bit. So let me know at any point if anything hurts, if you're uncomfortable, or you want me to stop. Okay?
Okay.
All right. So general assessment: patient is an overall good hygiene, dressed appropriately female. She appears her stated age. There's no signs of obvious pain or respiratory distress. She looks well perfused. Her skin is evenly pigmented, no obvious signs of cyanosis or pallor. When I look at her face, there's no obvious drooping. There's no grimacing or guarding of anything. So everything looks and appears good just on initial assessment. So now, Mary, we're going to go ahead and get started on just a bunch of different questions. So answer to the best of your knowledge. If you don't know an answer, that's okay. Just let me know, okay? So the first thing, I'm going to ask a little bit about histories. Do you or anybody in your family have a history of diabetes?
My grandmother on my mother's side, yes.
Okay, and then do you think you have diabetes or have ever been tested for that?
I don't think I have it. I've had numerous annual blood tests, blood work done, and I don't have any issues.
Okay, good. What about high blood pressure?
No.
Good. Have you ever had, any spinal cord injury, a back injury, head injury that you had to go to the hospital for?
No. Mm-mm.
Okay. Do you have a history or a family history of any type of neurological disorder or disease like MS or anything like that?
No. Not that I know.
Okay. The next questions are recently or have you experienced back pain or neck pain?
I have not.
Okay. What about difficulty doing everyday tasks?
No.
Okay. Have you experienced any weakness or numbness in your arms, legs, hands, or feet?
I have not.
All right, good. Sounds pretty good there. Then the last thing is, do you have any pain anywhere?
I don't.
Okay. Based on the patient's statement of no pain and given her affect, her facial expressions, no grimacing, no guarding, anything like that, I'm going to go ahead and omit the pain assessment because she doesn't appear to be in any pain. If she had stated that there was pain, we would go through old carts, onset, location, duration of the pain. Then you'd go through the characteristics. You'd go through the aggravating and alleviating factors. You go through the related symptoms, the treatment she has used, and then the severity on a scale of 1 to 10. But like I said, she said there was no pain. She doesn't appear to be in pain, so we're going to skip that. The next few questions I have are just about to figure out how you're feeling, where you're at. So the first one is, where are you currently? Are you sitting? Where are you sitting?
Sitting on a couch in my house.
In your house. Okay, and what year is it?
2020.
And then who is our president?
President Trump.
Okay, good. Patient is awake. She's alert. She's oriented. She's able to answer questions. She's oriented to self. She's oriented to place, to person, and to time. And her location. So that's all good. Next thing, just because it's important to ask and I want to give you the opportunity, have you had any suicidal ideation lately or any excessive thoughts of depression or anything like that?
I haven't.
Okay, that's good news. If any point you want to talk about that or you think of something that concerns you, let me know and we'll stop whatever we're doing to take care and talk about that, okay?
Okay.
So with that in mind, we're going to go ahead and now move on to our cranial assessment. Like I said, it's going to involve a bunch of different things, and we're just going to go through. I'm going to tell you what the nerve is we're testing, its name, and its number. If at any point you need me to stop, just let me know, okay?
Okay.
So the first one we're going to do is our facial nerve, and that is our cranial nerve 7. So with this, I'm just going to look at your face. I'm going to have you do some facial expressions. You won't look silly, and I'll do them with you if you want. First one, give me a big, huge smile. Good. Now give me a frown. Good. Now can you puff your cheeks out like a pufferfish? Nice. And then go ahead, raise your eyebrows to the top. Good. Did you have any pain with any of that?
No.
Good. The facial nerve, it's symmetrical. There is no drooping of her face. And so I'm going to say there's no deficit in the facial nerve, cranial nerve 7. The next thing we're going to go is we're going to go ahead and test your optic nerve, which is cranial nerve 2. How we're going to do that is I'm going to have you read this sentence that's on this little sticky note.
Okay.
Are those prescription glasses that you're wearing?
Yes.
All right, so patient does have prescription eyewear. She is wearing them currently. So like I said, just go ahead and read the sentence to the best of your ability.
How much wood would a woodchuck chuck if a woodchuck could chuck wood?
What a thought-provoking question. So optic nerve, there's no deficit. It was grossly intact. She read the sentence perfectly. Do you know the answer to that?
I don't.
A woodchuck would chuck as much wood as a woodchuck could. A woodchuck could chuck wood.
Good job.
So, grossly intact. The next one is going to be your auditory nerve, and that is cranial nerve 8. So what I'm going to do for this one is I'm going to have you put one finger on the tragus of your ear, which is just this little bump. Some people get it pierced. And I'm going to come and I'm going to whisper something in the other ear, and I want you to respond however is appropriate, okay?
Okay.
Let me know if you're uncomfortable at any point.
2020.
I asked her what year it was. She said 2020. Now do the opposite.
Mary Smith.
Mary Smith, I asked her what her name was. So the auditory nerve is grossly intact, no deficit there. Hearing was symmetrical. Now we're going to go ahead and move to your trigeminal nerve, which is cranial nerve 5. I love this nerve because it makes sense. Tri means 3, and each nerve has 3 branches, and it's the facial sensations. And so I'm going to test 3 different spots on both sides of your face. I'm going to have you close your eyes. And then I'm going to touch an area of your face, and I want you to tell me where I'm touching, okay? However you can best explain it, whether it's forehead, cheek, jaw, chin, however you feel.
Okay.
I'm going to use this little paper towel. Is that okay with you?
Mm-hmm.
All right. Go ahead, close your eyes, and tell me where I'm touching.
Left chin. Forehead.
Good.
Jawbone. Forehead. Cheek.
Good. You can open your eyes. So the trigeminal nerve is grossly intact. There was no deficit. It was symmetrical. She had equal sensation on both sides. And so that is all good. There's no deficit there. Now I'm going to go ahead and test some more movement of your eyes through a thing we call it the 6 cardinal fields of gaze. And I'm going to use my pen light.
Okay.
And I just want you to follow with your eyes everywhere my pen goes.
Okay.
So this is testing that ocular motor nerve 3. And then it's also testing your nerves 4 and 6, which are your trochlear nerves and your abducens nerves.
Okay.
So like I said, just follow. I'm testing for your eye movement. So keep your head straight. Good. What we're looking for is a thing called nystagmus, and a lot of people know it by doll's eyes. And so that's like a jagged movement. David? But her eyes move smoothly. There's no cranial deficit. There's no nystagmus present. So that all worked out well. Looks like symmetrical bilaterally. To test your ocular motor nerve like more thoroughly, we're going to go ahead and test your pupil reaction.
Okay.
So can I have you take your glasses off for this part?
Yeah.
Good. What I'm going to do is I'm going to shine this light and just briefly into your eyes to see if your pupils respond normally, okay?
Okay.
It shouldn't hurt. So like I said, if at any point you need me to stop, just let me know, okay?
Okay.
Good. So like I said, ocular motor nerve 3, and they are equal responding to the light. There's no delay, no deficit, anything like that. So they responded appropriately, which we would be concerned if one dilated more than the other, or if neither of them dilated, but it looks good. You can go ahead and put your glasses back on. The next thing, we're going to move to testing some different things in your mouth, which sounds weird because it's, your cranial nerves, But we are going to test cranial nerves 9 and 10,
Okay.
which are going to be your glossopharyngeal nerve and your vagus nerve. And these ones test like how your uvula moves, how your tongue kind of moves, different things like that. So what I'm going to do is I'm going to have you open your mouth and say ah, and I'm going to look with my light at the back of your mouth, okay?
Okay.
Go ahead and open and say ah. And then do it one more time. Good. So those nerves are grossly intact. The uvula rises and it stays midline, so that's an expected finding. There's no deficit, grossly intact. The next thing, we're going to test your hypoglossal nerve nerve 12. What I'm going to have you do is just stick your tongue straight out for me.
Okay.
Good. You can put it back. Tongue is midline, so that's expected. And then can I have you repeat these next 3 words after me, okay?
Okay.
Tight,
Tight,
light,
light,
dynamite.
dynamite.
Good. So there's no deficit there. The hypoglossal nerve is grossly intact. The last nerve we're going to test is your spinal accessory, and this is our cranial nerve 11. So to test this nerve, I'm going to put some resistance on your shoulders, and I just want you to raise them up and drop them down.
Okay.
And then I'm also going to push on one side of your face just a little bit, and I want you to turn that direction, and like I said, I'm going to put some resistance. I'm going to do that to both sides. Okay?
Alright.
So I'm going to start with your shoulders.
Alright.
Go ahead, raise them up. Good, drop them. Nice. Now go ahead. Good. Good. So the spinal accessory nerve is grossly intact, no deficit, equal movements bilaterally, equal sensation. Everything looked normal. There was no abnormal findings of any kind. Do you have any questions for me?
I don't.
All right, good. Then I will see you later.
All right. Thank you.